Hello, everyone. I'm Wes, and I use they, them pronouns.
I am Kyle. I use he, they pronouns.
And today we're presenting our project improving chosen pronoun and name displays in the electronic medical record to decrease the misgendering of gender diverse patients.
So 70% of gender diverse individuals reported facing healthcare discrimination. And what is gender diverse? So gender diverse is a term that describes people whose gender identity falls outside of cisgender man. And we have this neat little infographic up here. It's called the genderbread person. So up top, you see rain, and that refers to kind of gender identity, and that's our own internal perception of it. So I think internally man for myself. And the expression is how I present that to the world. So I dress in masculine clothing, and I also express other characteristics. So I have a tendency to kind of I have an appreciation for the arts. I love to bake. I love to garden, and those are considered feminine and stereotypically shouldn't necessarily be that way. But despite that, I still consider myself to be masculine. So gender identity and gender expression are related but kind of separate. And then sex is, what we learn in anatomy and development constantly. So to go a little bit more into the what gender diverse includes, there's a few different demographics that we have selected to talk about. So transgender refers to people whose gender identity doesn't necessarily match what we would expect at birth. So if somebody identifies as a woman that at birth they were assigned male, that would be considered transgender. Non-binary is when the individual is necessarily subscribed to either the concept of man or woman. They fall in between or outside. And then gender non-conforming refers to expression, and those people express in a way that doesn't necessarily fall into the societal expression of identity. So moving beyond that, gender diverse people often have a chosen name that differs from their legal or birth name, and that's about 2/3 of individuals. Their sex assigned at birth may differ from their gender identity and may not indicate their correct pronouns or prefix. So chosen name and pronoun are not clearly displayed in the electronic medical record, and this results in the use of incorrect pronouns, which is known as misgendering, and the use of the birth name rather than the chosen name, which is known as dead naming. And both result in adverse health outcomes and underutilization of healthcare services. So we just have a few quick examples for this. So this patient's birth or legal name is considered Jessica Johnson, but their chosen name is Aiden Johnson. Pronouns they use are he and him, and the title is Mr. So we wouldn't say Mrs. Johnson, we would say Mr. Johnson. We wouldn't say Jessica, we would say Aiden. And then when we discuss about this patient to other members of the healthcare team, we would use the pronouns he and him and not necessarily she or her. And then the next patient, we have Dante Jones. Their chosen name is Phoenix Jones. The pronouns are they and them, and the title is mix. And mix is just a gender neutral honorific, not necessarily Mr., not necessarily Mrs. And we would refer to them as Phoenix, and then they and them with other members of the healthcare team. So gender diverse patients are often misgendered or denamed in healthcare settings, and contributing factors to this that we noted were the EMR, patient identification stickers, and patient wristbands do not display chosen name or pronouns, inadequate and or limited training on the needs of gender diverse patients. The patient portal and patient letters address the patient by their legal name rather than their chosen name. And our aim was to improve the display and use of chosen name and pronouns to reduce naming and gendering errors. So right down at the bottom, we just have a sample banner of what we were working with before we made some changes. So this patient's name that is listed is just Brad, last name is easy test, and we'll kind of go into more details on the difference in display.
For methods, the first thing that we did is we started brainstorming all the different things that could be contributing to the misgendering of our patients, and identified 4 main categories. So training, this includes things like many people don't understand the current display, and then also knowledge on how to address and why it's important to correctly address our gender diverse patients. Systems, the way we do things. So in our clinic, there's a protocol of using patient stickers, which only have the patient's legal name to call them up in the waiting room. That's what leads to a lot of problems. And then no system of collection of pronouns, EMR display, it's hard to differentiate which is the chosen name and it's not listed everywhere. And pronouns are not displayed at all. And then technological complications, there's no place to input the pronouns, and then all the places where only legal name is to. So we came up with 3 main interventions. Our mentor, Dr. Uhlenhake, started with clinical staff training. This was through regular reminders via email and meetings with our clinic staff. And then we also weekly called the IT help desk to talk about the changes that we wanted to see. And then lastly, we initiated regular meetings with Dr. Hackman, the Chief Medical Information Officer at University. First, we, on the patient banner, which you saw an example of before, we now have the chosen name and pronoun in parentheses. We currently have the pronoun in the same field as the chosen name until we're able to find a separate field for that. So that's what we decided to do so far. On the schedule view, we now have chosen name and pronoun in parentheses, as well as if the sex assigned at birth and current gender identity do not match. You'll see this blue eye icon. And on the next slide, you'll see the layout of that. So administrative sex is the word the EMR uses for legal sex. And then you have sex assigned at birth under that, and then gender identity, which is current patient's gender identity. Some of the terms used in this field are a bit outdated. Like most patients would not prefer female to male, or male to female, they would prefer trans women or trans men. And then finally, we are currently in the process of reorganizing the patient wristbands to look more like this view. So in this example, the preferred name is Conway. We now have that at the top of the patient wristband. This is where the legal name used to be, and we move the legal name down to the bottom of the wristband.
So in conclusion, using patients' chosen name and pronouns is essential for gender diverse patients, and we do have a few remaining challenges. Most faculty and staff do not know how to add the chosen name and pronouns to the banner just because it's a very new change. The parentheses may confuse people just in reference to like, is this a nickname? Do I have to use it? Or is this the chosen name that I should use for this patient? Many do not understand the eye icon, and then updating patient stickers in the patient portal letters is still in the process because that's a large source when we're communicating with the patients of dead naming and misgendering, using incorrect honorific.
All right, lastly, I want to emphasize that using the correct name, pronoun, and title for our patients is the first step in providing affirming and inclusive care for all of our patients. Future directions, we want to expand this work to every single healthcare setting here at University Health and beyond. We'd also like to use surveys to collect data on how our changes are working, both from the perspective of patients and from the healthcare team. We're working on instituting pronoun badges on our hospital badges. This communicates safety to our patients and then also to the healthcare team as well. We want standardized longitudinal trainings for every department. And we also want to develop an organ inventory. This is a more inclusive way to figure out like what kind of screenings each patient needs. And so this is another important thing to be more inclusive of our gender diverse patients. And then lastly, we want to amplify this message. We want to get everyone involved and excited and dedicated to correctly addressing and including every patient.
And then we just wanted to give quick thanks to Dr. Jeffrey Hackman, who was the is the Chief Medical Information Officer. We brought up most of our concerns and changes that we wanted to implement to Dr. Hackman. Dr. Hackman was the one that implemented them. We would also like to thank the LGBT+ specialty clinic, faculty, and staff just for being advocates for the patients and bringing up these issues to us so that we know what we can work on. And we would like to thank our mentor, Dr. Uhlenhake, who has been our biggest advocate and also an advocate. And here are our references and Q&A.
You are going to take audience questions. Yes.
So I think one comment and a question. So I think it's really cool that you guys thought about the wristband and changing where people look. So using that human factors design about where people look to get names. I think the biggest question I'd like to ask is, one of the challenges, we may all have great ideas about the project we want to do, but getting the resources to do it is always a challenge. So how did you guys get in the CMIO's door to make this happen?
Lots of complaining. So, I mean, at the end of the day, I think it was just this hesitancy to get the changes in and like where do we start, what do we want to include. So I think reaching out to IT, which was our initial first step, is probably what precipitated everything else, and I got into contact with Dr. Hockman afterwards. And then challenges, I definitely think from my understanding that the main difficulty right now is clarification with billing as to which name, which sex is used, and then that also has limitation on our spaces for stickers.
Yeah.
Great presentation. My question for you is this, and you may have embedded this somehow into your work, but how, with each step along the way, did you incorporate the patient's viewpoint of what they prefer to be on their record and how it will be displayed?
I think a lot of the motivation for our changes came from our individual patient experiences. Dr. Uhlenhake's in the LGBT specialty clinic, and then we'd also have many of her LGBT patients in our clinic. So one example is Dr. Uhlenhake walked into a patient who was inpatient who had a wristband on, and it had their birth name right on the top of the wristband, and the patient was tearful and very upset. And so just lots of individual experiences that kind of got us like thinking and motivated about how we can change this. But I do think we would like to find a more formal way as well to quantify like patient experiences and hopefully how we can change.
And if I can add to that too, I think the reason why we implemented these changes so quickly, and we're still kind of trying to collect data on the impact of it, the human rights campaigns, health quality index already shows that 91% of the participating hospital networks in the survey already include all this information in some shape, way, or form. So it's just if you haven't had that yet, it was probably appropriate to follow suit. And then there's also been a few studies showing that concordance, so basically matching the name that they prefer to use and the name that is actually used in other legal documents, decreased adverse mental health outcomes by, I think, 32%, and then rates of suicidality by about 28%.
Yeah.
Showing that misgendering affects things like clinic follow-ups or adherence.
So we don't have any individual data on that, but other studies that we've kind of referenced in our reference list, and we wrote on the draft for a paper, they mention that specifically for teens at least, whenever there's an incident of not being misgendered, they are less likely to utilize either preventative healthcare measures or even just not even going to primary care clinics at all. And that was, I think, 32% of people felt that way, and then 70% of people have also faced that discrimination, which is
Really nice work. Thank you. One question I have is as you think about how this will work, it's really difficult to do widespread the terminology changes, something that's changing a lot over the last 10 years. Is there a way in the electronic health record to put on if you provide some definitions so that you can continue this education and people look at the sex whether they're a trans man or trans woman, because many people don't really know what the terms mean. And if there's a way to, as people look on these things and work with patients, that it's an education for the provider, so we continually increase the base of information.
Yeah, I'm not aware of the, any current capability for that. I think that would be a good idea. And yeah, I agree that like figuring out and implementing a good, up-to-date trainings is definitely gonna be a challenge that will need continual work.
Great, time's up. Thank you so much.